So firstly, my name's Emma Francis and I'm employed as a highly specialist mental health and autism spectrum disorder occupational therapist. I work as a lone practitioner and I cover the whole of Cwm Taf Morgannwg University Health Board secondary care mental health services. And I support adults with a diagnosis of ASD and coexisting mental illness. Slide 2. Thank you. So just to set a little bit of a context to my Bevan Exemplar project. So ASD is a lifelong condition. People with ASD are more likely to experience mental health problems than the general population. 79% of adults with ASD meet the criteria for a psychiatric disorder at least once in their lives. And the prevalence of ASD is approximately 1.1%. So this means that there are around 700,000 people living in the UK on the autistic spectrum. Many autistic people experience sensory sensitivities that interfere with everyday functioning. Slide 3. So this is the Need to Know document. It was formerly known as the Patient Passport when I started the Bevan Exemplar, and it promotes self-management by formulating specific sensory strategies that aim to reduce the likelihood of sensory overload. The Need to Know document communicates a person's unique sensory differences at times when they are unable to. So currently, the communication tool is co-produced with the person as part of intervention. And this intervention requires a referral by a mental health practitioner to the specialist OT service. Slide 4, please. So when considering aims for my Bevan Exemplar, it became apparent that the long-term vision for the Need to Know document would not be achievable in a year. So here what I've done is outline some of the aims that I hope to achieve under the Exemplar project. So the first was to explore a suitable title for the document, as anecdotal evidence suggested people found the title Patient Passport disabling when the document was used in colleges, universities and work settings. So aspects of the anecdotal evidence also indicated the existing paper document was not suitable for everyone. I especially found this with younger males that I was working with who found carrying a piece of paper around quite inconvenient. So then I had a light bulb moment. Everyone carries around a mobile phone. And wouldn't it really be awesome if we could develop a way of transferring all this valuable data for someone onto a mobile handset? So here was the idea. Let's try and make it into an app. So the idea for the app was that it would allow people to navigate through a series of sensory related multiple choice statements. The app would then formulate sensory strategies, and the final stage would be the transfer of the person's chosen strategies into a Need to Know document. And I think the most important part of this then was that there'd be no need for this specialist referral to specialist services. And it's a self-management tool that could potentially be modified to go beyond the autistic community and benefit others with lifelong conditions such as dementia. So taking a step back from the long-term vision, which was to develop the mobile application, I first needed to approach a reputable ASD organisation to find out if they'd be interested and willing to launch and host the app from their website. And prior to COVID, I had initial talks with an ASD organisation and they were extremely encouraging. Slide 5, please. So 2020, we've all seen ourselves in unprecedented times, and they've sort of affected us all and how we work. So prior to the pandemic, the Exemplar project was gaining real momentum. I had conversations with potential industry partners who showed interest in developing the project. However, it was through these discussions I realised there was more work to be done regarding the actual content of the paper format of the Need to Know document. And the aim of the project then shifted direction. The initial idea of developing the document into an app was placed on hold to allow for a full evaluation. I felt more comfortable with this solution as I wanted to ensure the potential app remained both meaningful and relevant to the user. Slide 6, please. So here I've included some direct quotes from actual Need to Know users. So what they've said is, it's an amazing tool, especially when I visit my GP or hospital. It's not always easy to express yourself. All my individualized information is detailed in the Need to Know document. Now all I have to do is to show it to them. It's a great help. It's a wonderful and empowering tool. It's great for communicating my needs at times when I'm unable to, and it avoids the need of repetition. Slide 7. Thank you. So next steps. So the next steps obviously involve continuing to work collaboratively with patients to ensure the document meets their identified needs, with a continued aim of improved patient outcomes and experiences. I'm currently in the process of carrying out a small-scale evaluation of the document that's been approved by Cwmtaf Morgannwg's Research and Development Department. And I've been in talks with 2 universities around using the year really that I've done with Bevan Commission as a first year of my PhD study. And through the PhD study, once I've managed to secure funding, I anticipate that the idea to develop the Need to Know app will actually be achieved. Thank you. Slide 8. So thank you. So I just wanted to say a little bit about my experience with the Bevan Commission. I've got great admiration for their support and enthusiasm for healthcare innovation. And I feel very grateful and privileged really for the opportunities that I've received.